Hello, everyone. Today is July 19th of 2022, and I'm here with Erikan. And Erikan, could you please introduce yourself and tell us what your job is?
Thank you, Emily. I'm called Baluku Erikan. I'm from Uganda and a core member of Synbio Africa. Currently in Synbio Africa, I coordinate the ambassador program, but also help with the laboratory procedures within the organization. I've been able to do work on a few projects with Synbio Africa, which includes the biosensor development project, project on phages that is currently running, and also other quite projects that are coming within the pipeline. I have a background in medical laboratory technology by training, having graduated with a bachelor's degree from Makerere University, but also actually a master's student pursuing a master's in molecular and cell biology at University of Cape Town in South Africa. So throughout my studies, at least I'm able to apply the few skills within Synbio Africa to make sure we can make a community of synthetic biologists and how to create more awareness about synthetic biology within Africa at large. But other than the work I do with Synbio Africa, I also volunteer as an IGM ambassador to Africa, helping to create teams within Africa that can create solutions for local problems using the synthetic biology aspect. Thank you.
Thank you so much. We really appreciate you being here with us today and you introducing yourself. Now, looking back to December of 2019, what were you doing then? And then how has any of your work or your research kind of shifted given the spread of COVID-19 in 2020?
Thank you so much, Emily. Actually, in 2019, by December, I was just 5 months away from the time I had completed my school. So I was just a recent graduate from the university, and that's when I tried to engage on a few projects, actually. And as I was moving around, actually on Twitter, I met a professor from University of Edinburgh, and he was trying to do a project on COVID. So through that, COVID came in January for people to understand about COVID. And during the month of February in 2020, I started my journey with a professor from University of Edinburgh who was working on a project on trying to develop a product that can help in testing COVID-19. So he was trying to look at a field-based approach for low-income countries to help them in trying to look at how we can test COVID-19 using less personnel that are trained, but also the few resources that can be in low-income countries. And this, as my career as a medical lab technologist, it actually drove my mind to concentrate on this kind of research because this was in the diagnostics part. And I realized that there was a need to develop more diagnostics to diagnose COVID-19 being a new disease. So my research went on to center in that aspect. But also, after that, in the middle of the year, I joined a company called Medical Access as just a volunteer. So when I joined that company, they were working on COVID-19 testing at molecular level, and they were trying to pilot a machine that can test COVID-19 that from Abbott that they had bought. So as medical lab technologist, I helped them in piloting the machine, trying to train workers. So I quite saw my life trying to go within the area of trying to help people in this field because the disease was around and the only resources that were there were turned off to try to curb COVID-19. So at that, I also had to provide in my knowledge and provide in my technical expertise to see how I can add up to the small initiatives by training people on how to test COVID-19 using these machines, the molecular-based machines. But outside that, as my organization is by Africa, we also looked at what can we do, but as we are doing through this work of innovation, so we decided to plan to organize a conference, which was to happen in 2021, but we started organizing it in 2020 to look at can researchers come together and discuss different projects, different innovations in the field of synthetic biology. So I can say that within a period of the year of 2020, I was able to do much work in the field of trying to help in driving these initiatives and trying to see how I can be part of the community that can help to curb COVID-19. But one of the things that I realized during that journey was about training people about safety, training about people about how can they keep themselves away from getting COVID-19. And these are one of the trainings that I myself, through community engagement activities, I was able to engage in on teaching people on hand washing, teaching people on how to sanitize and how best they could live safe within the environment. And those are the few things that I did for the year of 2020 for the whole period of time until I crossed 2021 when we had to hold a conference with Synbio Africa. Also, our paper was already up for that. We are collaborating with the lecturer from University of Edinburgh. So we're trying to submit it for publication. So work had been done, and I was so impressive that within a period of 1.5 years, I was able to do a multiple kind of tasks as for my profession, but also as Synbio Africa, we were able to have the success of our conference happening in 2021 that we had planned in 2020, irrespective of COVID-19, but was able to be well planned. Yeah.
Amazing. Well, it is so interesting to hear you talk about how you initially became involved with COVID-19 education and trainings and community outreach. And thank you so much for sharing that. And then kind of looking at the years that COVID-19 has been around, I know you mentioned at the beginning, you've been engaged in multiple projects and multiple aspects of work. So is there anything else that you would like to share about that work or about any other projects looking at 2021 and 2022 and kind of your current job?
Yeah, actually, what I can say is that one of the things I like to share is about that, even though one of the things that was a shift in jobs, because during 2020, most of the companies looked at how best can they maintain a small staff. And at that time, companies kept on like firing people out of the jobs. And that was the change that I saw happening. But also throughout my job, I also realized that there is need to create more innovative ideas to make sure we can tailor them towards the current pandemic. How can we fit in the pandemic? How can we tailor like ourselves to bring in this innovation? That's one of the things that I learned mostly, how to become flexible, because most aspects were doing the normal diagnostics. For example, in Uganda, my country I come from, the normal diagnostics including from malaria, TB, and we had no these other diseases that were not given much concern. But when COVID came in, we realized the need for people to understand things like hand washing. Cholera was there for a long period of time in our country. We had diseases that were caused by poor sanitation, but we never minded about washing hands. So I realized that one of the things that people came to understand is that you need to wash your hands, not only for COVID-19, but every infection that comes in that needs hygiene, that needs you to be safe by considering the sanitation, then you need to wash your hands. If that's the mode of transmission, you need to sneeze away from people. So there are many things that throughout my job as a medical lab technologist, I came to learn many aspects of disease prevention majorly. How can you keep yourself safe? Majorly in the lab. If I can talk about the lab, I myself, I used to work in the lab, but sometimes I did not put on a mask in the lab. And sometimes I was not just putting on my lab coat, but at this I had to change, put on some safety glasses, put on like double gloves, put on a lab coat, then put on an apron, and more of a complicated way to handle these infections. So there's much that went on to learn as a person, but also according to the projects that came in, I also realized that people tailored their innovations, as I said, all their projects towards COVID-19, because now people started on developing mobile clinics. They could move to the patient, try to pick this sample, and bring the sample back for testing, which was kind of a new era of, like in my country, people are not doing mobile clinics and medication. So at this time, I saw mobile clinics coming in as new projects, and this thing taught us much in the field of health, because it's not only COVID that we need to understand how to use mobile clinics or reach out to these patients, but also there are diseases like non-communicable diseases where people need this kind of care of mobile clinics. So there are many, as I've said, projects that came in, but those that were tailored towards COVID-19 quite taught us too much as people who work in the lab like me, to more take concern on understanding the disease and how to handle diseases, majorly COVID-19 being an infectious disease. How can we handle other similar infectious diseases, but also developing new protocols and procedures of running samples, and also understanding these infections that are airborne, are caused or transmitted through air. So these are the things that are one of the things that I had to learn. But also outside that, I also learned that COVID-19 also affects the economy. It's only not a disease that comes in to affect the health, but also affects the economy, because people that have been serving the economy through tourism, through other sectors of the economy, they were shut down. Shops had to close. So outside the perspective of just being medical lab technology, looking at disease, I also realized there was change in the economy in a way that businesses had to shut down. People had no food to eat. There are other indirect outcomes that came out of COVID-19, because people are rendered at home, they are doing nothing, students went out of school. And there are many things that accompanied it as a disease that came as outcomes of the consequences of COVID-19. So there are quite a number of things that I learned, and I can say that it's something that was that opened up my mind as a person, and also helped me to learn how to be flexible and be part of a community that creates new interventions.
Yeah, thank you so much for sharing that perspective, especially about innovation and a few of your lessons learned. It is so important, and your work has been so instrumental to your community. And then kind of looking at what comes next for you, what do you think that the next 6 months look like, and what direction do you think that your work is going in?
Thank you so much, Emily. Actually, what I see my next 6 months from now is trying to now try to look at what could be, what has COVID is now there. It is now a disease that is to live. But now, if this is a disease that is to live with people, how best can we try to look at creating solutions for other, I can call them comorbidities of COVID-19, because COVID-19, people can still get COVID-19, but if they're not healthy, then it will take them down to bed. So trying to keep people healthy is one of the things I look at as a medical practitioner, trying to tell people how best they can keep themselves healthy, boost their immunity, and make sure they can live with this COVID-19, irrespective of it being an infectious a disease that can kill within a short period of time if you're immunocompromised. So that's one thing that as a medical practitioner I'm looking at, but also as by Africa as a company, we're looking at bringing more innovations that only not look at COVID-19, because as I've said, it's a disease to live, also from a broad perspective of what other things can be done for the African continent, other than, because like I said, food security has been a problem even after people got COVID-19, but people are not feeding well. And this has been a long-term problem, for example, in Africa. So one of the things we are trying to look is to embark on projects that that are in the field of food security. How can we create sustainable food for the African continent? How can we create innovations that can help people do work in different fields, like the health field, but how can people easily access health services? So we're looking at those projects that can help people deal with the disease, but also be able to access, like, as I've said, these health services. So such kind of innovations are the ones we are trying to look on. And in my next 6 months, those are the things I'm looking on to help the communities, to help the other young innovators outside there, because I've been helping students who want to come up with innovations to make sure they can have innovations in this field, but also embark on my master's to see that I can continue with it and make sure that I have another profession in times to come to uplift my career. Yeah, that's the thing that I'm trying to look up to.
Well, thank you so much for sharing your perspective and more about your work, Erikan. We really appreciate hearing more about all your efforts and a little bit about your education and your master's as well. And truly, you have been such an important player in pandemic-related efforts. So we really appreciate all the work you have done and your time sharing a little bit about your story with us today.
It's also a pleasure to also share my story